a huge welcome to you for joining our Carers Active campaign webinar today. We will be recording today's webinar, so if you don't feel comfortable with having I'm not quite sure how it works when it's recorded, but if you wanted to take yourself off camera, you're very welcome to do that, and that will be available for people who couldn't join us today. And we're really pleased that you could join us today. If we could ask you, please, hopefully we're all a bit used to doing this, but if we could ask you to stay on mute if you're not speaking, just to help everybody with background noise. There's obviously, as I'm sure you've imagined, there's time at the end where we'd love to hear your questions. Obviously, I want you to come off mute then. If you haven't spotted the chat box yet, please do have a look at that. If you have any questions or comments throughout the presentation, or if you're having any difficulties, please do pop a comment there, and one of the team will help you with those today. So in case you weren't sure why you were here, so what you'll be getting today is an update on the latest developments of our brilliant Carers Active campaign, including our soon-to-be launched Carers Active Best Practice Guide. So please do look out for that coming very soon. We're also going to be hearing from our independent evaluator about the key findings from the recent Carers Active evaluation report, which has got some really interesting findings and some really helpful ones for thinking about what you might do with your physical activity work locally. And we've got some focus on carers' health and their well-being and their social connectedness as well. We're also delighted that we're joined for some people who are actually doing the work. So we've got some good practice examples from organisations who are already successfully supporting unpaid carers to be more physically active, which we hope will give you some ideas, or just to give you a chance to share your good practice as well. So before we get started with our first speaker, we just wanted to get 30 seconds of your time to do a very quick poll for you. And if we could get that up on the screen now, please. This is obviously the point where we rehearse this, but obviously it may not work in the actual, it's there. So the question that you should be able to see on your screen is, and if you can't, don't worry, you can pop it in the chat, is how confident do you feel in engaging with the Carers Active campaign? Do you feel very confident, quite unconfident, very unconfident, or not sure? And if you aren't able to access the poll, if you could pop that in the chat and we can capture that there. But if you could please vote now, she said, in the manner of a chat show host. And I shall rely on my returning officer to tell me how the poll is doing and when the poll will be closed. Oh, the returning officer has just let me know that apparently the poll is done. So are we sharing the results of the poll with the populace? I feel that we should, in the manner of a civilized democracy, but obviously we may
Laura,
be
you
keeping those
can
for later,
see
I don't
them.
know.
You can see them in the chat, the results.
I can't because I'm the speaker.
Okay.
So perhaps that's something that, let's see if I can click off that window. And thanks for that. That's really helpful, John. And hello, by the way. So most people are feeling quite confident. So we shall elect quite confident as our current candidate for this webinar, but which are closely followed by people who are quite unconfident. So people who are perhaps emerging in their practice in this area. Very confident is the next one at 15%. And then not sure is 21. So hopefully by the end of this, we'll feel that you feel more confident. And then we've got some very confident people at 15. So that sounds like that's good and that you're in the right place to learn and share your experiences. And we'll be able to, help you with those as we go along. That's fantastic. So I'd now like to pass you along to Patrick, who's our brilliant Carers Active campaign project manager. And Patrick's been leading this campaign for the last couple of years and producing some fantastic results. And Patrick's going to talk to you about the programme now. So Patrick, over to you.
Thanks, Laura. Thanks very much. I'm just going to share my screen. Hopefully you can all see that now. Great, thank you. So yeah, we just wanted to start the webinar today with a little bit of an update on the Carers Active campaign, because I know some of you will be more aware of it than others. So just wanted to provide a bit of an update, and then also talk a little bit about the best practice guide, which, as Laura mentioned, we'll be releasing shortly. So firstly, I thought it'd be important just to set the scene a little bit and look at where we feel the situation is currently around carers and physical activity. So as the slide heading says, there is significant levels of inactivity among carers compared to the whole population. So you can see that stat: 51% of unpaid carers are inactive compared to 27% of the whole population, and that's based on a comparison with Sport England's activity figures. What plays into this in our research and in direct feedback from carers is we know that they are more likely to have long-term physical or mental health conditions, disabilities or illness, are more likely to have problems with their own physical mobility, and are less likely to make a GP appointment for their own health needs. So all of that, bearing all of that in mind, it makes physical activity even more important for carers. We also know that there are significant barriers, and I'm sure many of you are aware of these as well in your work with carers, but our research shows that some of the biggest ones are not having time to take part in physical activity, not being motivated or having the energy, not necessarily being able to afford the costs of activities or sessions or classes, and not having anyone to go with, or kind of feeling anxious about trying something for the first time. We also know that a couple of other barriers that aren't mentioned here that are significant are kind of perceptions of physical activity and what it means, and also sort of guilt in taking part in something for themselves and leaving the person that they care for. There's also quite a significant link between with carers and loneliness, and kind of being inactive and how that relates to being more lonely. And so you can see on the table on the slide, the inactive carers are often or always more likely to feel lonely, so 37%, and only 1 in 10 lonely carers are happy with how active they are. And that's been a key part of the campaign, is to try and reduce that loneliness through physical activity. So the Carers Active campaign is a 3-year funded campaign by Sport England. We've just recently come into year 3 of that campaign, and just wanted to highlight some of the things that we've done so far in the first couple of years. So we've developed a Carers Active Hub, which is an online central point with resources, information, ideas, videos for carers and organisations supporting carers. We've established the Carers Active April campaign month, which hopefully some of you have engaged with over the last couple of years, and we will be running that again in 2024, and we'll be sending more information about that in the new year. We've run online physical activity sessions, so some direct activity delivery with carers, and we continue to do that with sessions monthly. We've also started a volunteer programme with some online champions helping engage and support carers with their physical activity. And we've a sort of significant part of the campaign, an important one that we want to do more of this year, is raise more awareness and build partnerships with the range of organisations such as yourselves, carers organisations, local authorities, active partnerships, leisure providers and charities. And we've also last year carried out the mapping exercise. So we wanted to understand what was currently on offer for carers around physical activity in different parts of the country. So yeah, thank you all for taking part in that, and that's really helped shape the best practice toolkit. Speaking of which, as we mentioned at the start of the webinar, we'll very shortly be releasing this best practice guide, which quite a lot of effort's gone into this, and it's been developed and shaped through the mapping exercise that I mentioned, and some direct feedback from carers. So thank you all if you took part in the survey last year to understand what was currently going on around physical activity for carers, and what was working and what you'd find useful. It came back quite clearly that a best practice resource and toolkit would be very helpful, hence why we've developed this. So it does feature lots of background research and stats, which you can use with in your own work locally or any funding applications. We've got lots of best practice examples in there to sort of inspire and give ideas about how you can engage carers, both adult and young, and some top tips for overcoming main barriers, as well as some links to resources and other useful links. So just quickly, because I know we're tight for time, but I wanted to also just outline what our plans are for year 3. So I've just mentioned the best practice guide. So we want to disseminate and share that among lots of different organisations and professionals to start a conversation about carers and physical activity. We want to maintain the communication with carers and engage even more of them through the Carers Active Hub and our monthly newsletter. We want to keep developing resources that are helpful for carers, such as a goal setting and journal platform. And we want to increase the volunteer programme, and so that we look at more local leader roles, such as walking leaders, and maybe a sort of befriending role as well. And obviously we have Carers Active April taking place in April 2024. So that concludes my part around the update. I'd like to segue across now to James Bowles, who is with Aptelligen, who are our evaluation partner, and we've worked closely with them over the last 18 months. They've done some really good work on measuring the results, some of the data and findings from the campaign so far. So James is going to talk us through some of the main insightful findings from that report now. Thank you, James. I think you might be on mute, James.
It was bound to happen at some point, wasn't it?
No
there we
worries.
go. Can you see the slides okay? Yep. Okay, thanks. So hi, I'm James from Aptelligen. We're a specialist research and evaluation company, and we work with public sector and non-profit organisations to help them understand their impact, to help them make better use of their data, to inform their sort of strategic direction, and to build positive data cultures as well. We've been working with the team at Carers UK to evaluate the impact, the reach and the implementation of the Carers Active campaign since the beginning of last year. And we'll carry on until the middle of next year, when we'll write our final report. But in the meantime, we've written an interim report which presents our early findings about the impact of the campaign. So there's far more detail in the report if you're interested, and the link to that will be sent around after the webinar. So our findings are based on data from carers, so from a range of surveys, from interviews with carers who are involved in the campaign, as well as a cohort study where over 6 months, 15 carers gave their fortnightly reflections on their physical activity levels. So we can see how these have changed over time, and what's helped and hindered them in being physically active. So it's a really rich data set. And interestingly, we found that carers who were engaged in the cohort study told us that the fortnightly prompts were useful for them to look back and reflect on their physical activity levels. And they found the process of keeping a diary motivational in itself. So some carers have actually chosen to continue to receive the fortnightly diary forms after their initial 6-month period. And we also worked with a range of professionals who support carers in various ways, including through 2 in-depth focus groups where we looked at the impact of the campaign and how Carers UK could support organisations in different ways through the campaign. So in terms of the campaign's impact on carers, we've seen good evidence that the campaign is successful at helping carers to recognise the importance of physical activity in their lives, and to be more aware of the activities that are available to them. And also to reconsider some of their previous assumptions around exercise, and what exercise might look like for them, which, as we see, as Patrick mentioned, is often an issue for carers. And we've seen that carers who engage with the campaign have sustainably increased the amount of physical activity that they do, both through online and offline activities. An important part of the campaign is that lots of the activities are free, which immediately removes a significant barrier for carers. And the availability of online activity sessions means that carers don't need to find respite care. They can often take part in an online class whilst being within earshot of the person they're caring for, and carers routinely tell us that this is really helpful for them. Carers report that they feel fitter, they feel more physically capable and confident to take part in activities, so to exercise in the first place. And interestingly, many carers say that being part of the campaign has helped them to feel fitter for their caring roles as well. So obviously the caring roles can often be physically demanding. And carers have also recognised that being fitter makes them less susceptible to injury overall. Carers who are involved in the campaign or engaged with it regularly report feelings of improved happiness, feelings of increased self-worth, and a reduction in anxiety and isolation and loneliness. So we hear lots of things like the campaign's made a lot of difference. It's inspiring me to exercise more and stay as healthy as possible after putting myself second after caring for a long time. It's great for me. And in the bottom right, we have a chart showing feedback from the online activity sessions, where we can see that the majority of respondents report that they feel a sense of achievement after taking part in a class, and that they're both more motivated to exercise in the future and through the campaign are better aware of the opportunities to do so as well. In particular, we heard that carers value feeling part of something bigger, particularly with people who understand some of the challenges that they may face as carers. And seeing other carers posts on the Carers Active Facebook page is an important part of this. So in summary, we feel that the campaign is achieving its aim of supporting carers to recognise the importance of physical activity and also to be more physically active in their day-to-day lives. So those are some of the big impacts that we've seen on carers, but we're also interested in how the campaign changes the wider system or sort of landscape of support for carers to help them engage in physical activity. And in this regard, we've seen that the campaign is great at increasing cross-sector awareness of carers' needs and their particular access requirements as well. We've seen that it's brilliant for encouraging new partnerships to be formed, both at sort of national and local levels and between sectors as well. And we've seen that the campaign provides an important national backdrop against which local campaigns can be organised. So the fact that this is a national and ongoing campaign gives sort of added weight and significance to local initiatives. And we've seen new opportunities for carers being provided by partner organisations directly as a result of the campaign. And part of this has included an increase in the number of discounts that are available to carers. The Carers Active Hub, sort of the central portal that Patrick mentioned, is seen as an important place for professionals from a variety of sectors to find resources. So we've seen a range of organisations sort of get behind the campaign, find inspiration in the campaign to run local activities or reconsider how they involve carers' needs in their work. And so it's really exciting, and we know that Carers UK plans to build on this success in the coming year. So in terms of recommendations, the key points really are that carers and professionals want more of the same, including Carers Active April, which Patrick mentions, an annual period of sort of more intense campaign activity. And we know that Carers Active April is a really important catalyst for engaging carers in the broader campaign. So many carers who sign up and take part in Carers Active April and things like the Healthathon then continue to be engaged with the campaign and exercise afterwards. It's a really important catalyst for getting carers involved. And both the campaign and us as evaluators could engage a greater diversity of carers and also encourage and facilitate partner organisations to sort of collate and collect local action stories. So things that happen on the ground that take place as a result of the campaign. And finally, a recommendation of the campaign is to continue to engage and develop resources for partner organisations. And obviously the best practice guide is an important part of this. So as I said, we're working with Carers UK until the middle of next year. And in that time, we're shifting our focus a little bit to look at the system level and to understand the impact of the campaign on organisations. As well as exploring what the future could or sort of should look like in terms of providing carers with the motivation and opportunities to be more physically active. So there are 3 ways that we'd absolutely love to work with you. The first is if you work with carers who are either younger or from minority ethnic backgrounds, then we'd really appreciate the opportunity to speak with some of those carers about the campaign or involve them in our cohort study, which is our sort of fortnightly journal reflections. So please do get in touch with me if you feel that you can help in that way. And secondly, we'd love to hear about how you support carers to be more physically active. So either directly via my email, or please get in touch with Patrick, or through the mapping survey, which Patrick mentioned. We're running similar sort of exercise in January. So we'll look at what physical activity opportunities are being provided for carers. So please do take part and contribute in that if you can. And thirdly, we're running some system shaping workshops, we've called them, in January and February next year. So we've got 3 separate workshops, one for health professionals, sort of self-defined, one for sports and leisure providers, and one for carer support organisations. So we'd love you to join us to firstly hear about what everyone else is doing, so to learn from our peers, as well as spending some time thinking about what the future could look like, or should look like really, in helping and supporting carers to be more physically active. So my email's at the bottom of the screen, and we'll send the links to sign up to the workshops around after the webinar as well. So thank you so much for your time. I'll be very happy to answer any questions about the evaluation at the end of the session. Thank you. Back to you, Patrick.
It's actually back to me. Thank you
Back
so
to Laura.
much. That's absolutely fine. These live broadcasts can be. Thank you so much, James. That was incredibly helpful. I'd now like to pass over to Steve Varley. Steve's the service manager at Encompass Towards a Brighter Future. They're a carers organisation based in the Northwest. And they've been delivering a wide range of activities, and they've got a really strong infrastructure and volunteer programme. And I can tell you that they will also feature in the soon-to-be released Carers Active Best Practice Guide. So, Steve, thank you so much, and over to you.
Good morning, everybody. Thank you for the opportunity to be here today, and thanks, Laura, for the introduction. I've got a few slides, and I'm not very tech savvy, so somebody's going to do the slides for me, because every time I try to do them myself, something goes horribly wrong. So I'll just say next slide, please, which will remind me of COVID times when we heard that quite regularly on the television. So just a bit about Encompass then. We are a charity, as Laura just said, and we're based in the north of England, Preston, in fact. It's really cold here today. And our primary sort of aims and objectives are on this slide, really. So we help people to regain control of their lives by providing hope and a sense of purpose for people through the provision of our primary services, which are carer services, advocacy, counselling, wellbeing and volunteering services. But we supported over 25,000 people last year to do that by building resilience, and we work in a way that encourages them not to rely on services, and that's something that runs as a theme throughout all our service and throughout our organisation as well. As it says on the slide, we place people at the centre of everything that we do, and we deliver excellence by utilising people's strengths to stay well. That's really important to us, that we always make sure that we're working in a way that encourages people to, recognise the strengths that they have themselves. We have grown quite a lot over the last few years. We were originally quite a small charity working exclusively in Lancashire, but we've sort of spread our footprint a bit, Greater Manchester, Merseyside, Cumbria and Staffordshire. Next slide, please. Okay. So today we're talking really about our carer service offer. I'm one of the service managers within Encompass who are responsible for the delivery of the services. And as I've just said, our footprint is northwest wide now. We've got 40,000 carers registered with ourselves, and we provide support carers to help them to improve their health and well-being and to enable them to continue in the caring role for as long as they choose to do so. We just heard a bit about digital offers as well, and that's quite important. I'll come back to that later. Something that Encompass didn't do much of pre-COVID, but once we had pandemic times, I think like a lot of other organisations, we had to change the way we worked, really, and we started to do quite a lot of work online, and we've continued with that because it is quite a popular option for people. Just to mention that we carry out statutory carers assessments in most of our services. The ones where we don't, we do carers wellbeing assessments. And for us, that's a bit of a starting point. It's sort of the opening conversation where we will speak to carers, and the health and wellbeing agenda is a primary part of that conversation. Statutory care assessments carried out on most of our contracts now, and carers' personal budgets can be awarded, which I'll come back to because that's actually quite an important thing for some carers in terms of giving them some money to be able to engage in some physical activities. Next slide, please. So as I just mentioned, the carers assessments is generally our starting point for looking at, what carers can do to stay active, but there are a few other things here that I wanted to mention as well. So we do quite regularly surveys through SurveyMonkey, Microsoft Forms, and through our newsletters to ask carers what sort of activities they would like us to provide, and that's really quite important because I think. And I'm really guilty of this. I always think, a lot of carers who are quite old, well, they won't want to do this and they won't want to do that. But in fact, quite often I'm wrong. So we find that it's really important that we ask carers what they would like us to deliver. We can't always do everything. We had one the other week who wanted to do skydiving, but that's not happening. As we've mentioned before, we earlier in the presentations this morning, it's really important to look for other people that can support us to deliver these activities. We can't do it all ourselves. We just don't have the capacity or the skill to do that. So we look for sessional instructors, volunteers and local partners that can lead activity sessions and look at what is already there within communities as well that we can tap into. I've just put on the slide here about carrying out risk assessments, which might sound a bit administrative and a bit dull, but it is quite important that some of the activities we do, particularly outdoor activities, we will generally just do a bit of a sense check to make sure that it's safe and that, we've got proper arrangements in place like first aid and stuff like that to make sure that we've got every sort of base covered with that. We promote all our sessions and events that we do through quite a lot of different ways. So we have newsletters that go out to carers every 3 months across all our services. We also send out e-bulletins. We have a carers community network as well with over 2,000 carers who are members of that. So we promote what we're doing through that and through our Facebook page as well. We found it's really important, and this is actually quite a thing I wanted to mention today. We do have quite a sort of focus on making sure that we have places, bookable places, rather than just say to people, hey, we're doing a walk-in wherever next week, turn up if you want to, because the problem is quite often you can get overwhelmed, or we have had this where we've had like 35 people turn up and we've arranged with a local partner to take 10 carers on a walk. So it's really important that we do try to have a booking process so that we can control the numbers of people that come forward. And if activities are generally really popular, we'll just put more of those on. We can easily just change what we're doing and when we're doing it as well. Really important as well to listen to what carers think after the activities and be prepared to change to meet whatever they say. If there are barriers, so we had one very recently where we changed the timing of something that we did because it was not a good time. It was a lunchtime, I think it was, and the carers had said, this would be much better in an afternoon, and in fact one of them was an early evening. So we find it's really important to evaluate what carers are saying and make changes to suit them. Next slide, please. I just put a slide here of some examples of things that we do and have done in the past. Most of these are current things that we do. So wellbeing walks in local communities and places of interest, that is one of our really popular options where carers can come together. And it is just about going for a walk and talking to each other, and that peer support that carers get from each other. Some of the feedback we get is pretty amazing. People with similar interests in particular get the opportunity to speak to each other. We do work quite extensively with local fitness centres, gymnasiums, that's an old-fashioned word, isn't it? Swimming clubs and what have you, to get discounted or even free passes. Quite often, places are happy to let you have free access at the quieter times of the day. So we do have quite a lot of carers who take advantage of that. some of these things, archery sessions, when I saw that, I thought, look, I just don't remember that. But it's just interesting to see that we've put on activities based on what carers had told us they'd like. So there's some things on here that sound a bit off the wall, but they're really popular. They're what people, have asked for. And we've been able to source most of these activities within local communities for carers, which is great. I'm not going to read through the others. Kayaking and boating, that was quite a good one. Yeah, loads of stuff there as well. I've also put on the list community-based coffee and chat sessions, and you're probably immediately thinking, well, that's not doing much to keep carers active. But in fact, it does. If you've got, somewhere where carers can just go and meet up for just a coffee and to talk to each other, it means that they're getting out of the house. It means that they're making, an effort to travel somewhere and meeting with other people. So for people who don't want to walk 3 miles or go, on something that's a bit more intense, it just gives carers the opportunity to just get out of the house and meet with others. And that is one of our most popular things that we do. And I'm probably being a bit stereotypical here, but that does tend to really be a very popular option for older carers who just might fancy a gentle walk out, have a chat, have a coffee, and then make their way back home again. Yes, I mentioned earlier we do quite a bit
Steve,
of.
I'm sorry to interrupt. You've got 1 to 2 minutes
All
left.
right.
I know 10
Okay.
minutes can come hurtling towards you horribly fast, can't it?
Fitness sessions, we offer those on Zoom. We have a volunteer who is a professional health and fitness coach, and he runs sessions for us online. I've already mentioned the walk and talk sessions, and yeah, signposting to what's already there. That's really important. Last slide, please, then. So just quickly, I won't read through this, but there's some feedback that we've had from carers recently. And thank you. Questions at the end is great.
Oh, Steve, thank you so much. You were nearly there. That's fantastic. I'd now like to pass over to Taskin Salim, who's CEO of Subco Trust. Subco Trust recently celebrated their 30th anniversary. Congratulations. And they work with isolated and housebound older people in the London Borough of Newham. And Taskin's going to talk to us about how they've used physical activity to boost the health and well-being of carers of Southeast Asian origin as well. And they also feature in the soon-to-be released Carers Active Best Practice Guide. So Taskin, over to you. Thank you so much for being here.
Thank you very much, Laura. And it's really a pleasure to be here and to share some of the work that we've done locally in Newham in London. And it's great to know there's so many people coming from across the country. And I'm going to do the same thing. Next slide, please. Okay, so as Laura mentioned, we've been around for 30 years, and we started off with providing services for Asian elders because there's a lack of services and access in traditional services. So we do a range of services for the over 50s, and you can see them there. Some of it's very complex work, and some of it's more about preventative and social support and reducing isolation for older people. Included in all of this is right through everything that we do is how we work with carers, because most people that we've worked with have been carers at some point, are carers now, or maybe carers in the future. So it's a holistic program that we provide at Subco. So all our activities are inclusive of carers as well. And we also have separate activities and separate support groups if people want to look at particular areas of their caring role that we can then target with them. And that's all based on information that's been sent to us. We work on the preventative programs, and we've worked like others with partners in order to deliver those. Because one of the things that we find is because most of the people that we work do not have English as a first language, it's very hard to access services universally, but particularly when you're emotionally upset and distressed because of the situation that you find yourself in, whether as a carer or as an older person or as both. And to be able to express yourself emotionally in a different language is very hard. So what we've done is we've worked with other providers in terms of looking at how we can co-facilitate, particularly around well-being activities, mental well-being as well as physical activities. And I'll talk a little bit more about that later on. And we also find that intergenerational work, working with young carers and older carers, is very, very important in terms of trying to break down some of the barriers as well. Next slide, please. One of the things that we've experienced is that very often the carers that we work are very mistrustful of statutory services because they're not quite sure why they're asking all these questions about who I am, where I'm from, what do I need. So a lot of our work is about explaining why the information is needed. And it's important for them to be able to access services, but it's not going to be used in any detrimental way. We also find that a lot of carers we work with, particularly from South Asian communities, feel very, very ashamed of asking for help because traditionally it was seen that the extended family would look after everyone. You know, there would be an aunt, an uncle, a grandparent, a daughter, a son, a sister-in-law, a daughter-in-law who would do that. And it seemed like maybe we don't care, and that's why we're asking for help. So that also is something that we have to deal with and break down via discussions and support groups. And also on top of all this, we're in one of the poorest areas in the country, both in terms of poverty, but also in terms of digital exclusion. So it's great to hear there's lots of activities online. But again, for the people that we work with, that for 90% that doesn't work. So a lot of the work has to be face-to-face. And then what we do once they come in and we're working with people, we do actually introduce them to digital technology and also look at ways of how we can access free data for people to take away at home once they have learned things on how to access information online and support them through that. But again, most of this is in English, so again, people miss out on some of that. And that's why, again, partnership working again is very important, that we can help facilitate that. And again, a lot of the carers that we work with, some have self-referrals and others have been referred by their GPs or other health services, and they have multiple health conditions themselves as carers. So again, it's very important for us and them and the person they're caring for that they understand their illnesses and what they can and can't do, so they can take some control back as well. And bearing in mind, again, like I've said before, there's particular language, cultural and religious needs as well. So again, making sure that services that we're provided are culturally appropriate, with people who speak the appropriate languages, staff, volunteers, facilitators, also understand their cultural background, the way they dress, and the way they may not want to dress in certain, dress codes if you're exercising, for instance. And then we are then able to support people to raise those issues through different forums, whether as older people or as carers or as both, because older people are carers, some of them that we work with as well. So I don't want to differentiate too much, but at the same time, I think it's important that everybody has the opportunity to cross over in their different roles that they play in life. Next slide, please. So some of the activities we put on is as you can see, is can be very gentle exercise in terms of chair-based exercise, because people have multiple health conditions. Also thinking about things about mental well-being. So again, yoga and meditation and relieving stress is very, very important for the people we work with, and particularly carers, in terms of having that time to themselves and being able to do that. In the last 3 years, we've got our own football team. So we're able to play with other teams. Some of them, not all are carers, 60% are carers, 40% are not at the moment. But as I said, the role is interchangeable during their life course. And again, it's very difficult to get men active. And one of the things we found is that through things like cricket and football, you can really get that camaraderie and friendship. And out of that, people then get involved into other services provided by Subco or other services we can signpost to them, whether it's around a carer's assessment, whether it's around a sitting service, whether it's around how do I get onto an exercise program, how do I get advice and information about my financial struggles that I'm having. So in a way, it's like a lever into other things as well. So that's why it's important that we're looking at things around bereavement services, healthy living, as I've just mentioned, but also things around emergency planning. As carers, again, you can't think about yourself unless you know, something happens to me, I've got a plan in place that who's going to look after the person I care for. So again, through the activities we do try and make sure that we have a holistic approach in terms of how we can share information. Next slide, please. So just the last slide now. So it's really, again, just looking at what carers have told us about when they've enjoyed sessions, what it's meant to them, and what some of the barriers are as well, and some of the difficulties they're having. So I'm not going to read it all out because it's there, and we're going to be sharing the slides later as well. But as you can see again and again, things about feeling very lonely, very stressed, language, culture, being respected for who they are is very, very important to carers. And one of the things that's happened recently, we've just won a 3-year contract with 2 other organisations locally to provide all age carer services for the next 3 years. So we'll be able to take on a lot of the things that people have said to us over the last few years and making them a reality, and through partnership working, because we are a very small organisation in comparison to many others, but we have a very big impact because we work with others in partnership. So again, when we're facilitating, when we're having consultations, we're looking at doing that in different languages with our own volunteers, our own staff, but looking at the same time in how we can be supported in terms of resources. So it's a quid pro quo as well. So it's not just using us because we want to reach the Asian communities, but we value what you have to offer. And here's some resources, either in kind or financial, that we can give you to do these services. And again, just to end up in terms of people's caring roles, at the moment, the number of people that we're working with are older carers themselves, so they have their own particular needs as well as the needs they have for the person they're caring for. So again, making sure that we're able to look at both those needs, and the cared for has their own assessment in the same way as the carer has their assessment, but then looking at how those can be brought together, because unfortunately social care looks at things very separately. So you'll have somebody doing the assessment for the older person, somebody for the carer, but they don't talk to each other, and sometimes the plan that comes as a result of that doesn't work. So it's our role to support carers and older people to advocate in terms of what they want and how they want it to be provided. And I think I've just got done my 10 minutes. So thank you very much, and happy to take questions later on.
Thank you so much, Taskin. That's absolutely fantastic. I'd now like to pass over to Patrick Krasnicki, who's Community Sports Manager for the London Borough of Barnet, with the National Leisure Provider GLL. GLL gave Carers Active April campaign that Patrick spoke about earlier some fantastic support during that month. They introduced a special membership rate for carers, and they set up some introductory days and sessions at centres across the country. So we're really grateful for that support. Thank you. And they've continued to work with Carers UK to make their offer and venues as inclusive and accessible and affordable as they possibly can be for carers. So Patrick's going to highlight for us now how, as a leisure provider, they've really used the Carers Active campaign and engaged carers to leisure centres across Barnet. So Patrick, over to you.
Thank you, Laura. Hi, everyone. Yeah, my name is
I think it might have frozen up. Might have just lost Patrick.
Okay, I was
there.
just frantically messaging the chat. So, we've slightly lost Patrick for a minute. So Patrick, if you can give Patrick a ring just to find out what's going on, and whilst we're doing that, if you'd like to start thinking about any questions that you might have for Patrick, James, Stephen, Taskin for the practice, you could start pasting those in the chat, because then we can make sure that we're taking those later. Really sorry about this. Let's see what news we can have from Patrick in just a second once he's had a chance to speak to Patrick. John, you've got your hands up. I don't know if you're able to post that question in the chat. Otherwise, we can take it now. Just while we're waiting to see if we can get Patrick.
Well,
Patrick
I
back.
just thought I'd be a space filler while you're waiting
Oh,
for
you
Patrick
can
to
talk
come
about
back.
football? Yeah.
Yeah, well, yes, no.
Okay.
I mean,
John, introduce yourself because not everybody knows you.
Hi, yes, my name's John Bangs. I'm a carer, live in Kingston-upon-Thames. I work as an independent carers policy advisor. I'm also a member of Carers UK. I had done some work around young carers and football for the Young Carers Alliance, and following that, we've had some interaction between the Young Carers Alliance and Carers Active. And I just wondered whether it might be a good idea. There was the conversation about having workshops to look at how the work's being embedded for the future in the new year. And I was just thinking it might be helpful if we looked at doing something together, like we did a few months ago. Patrick did a webinar with the Young Carers Alliance, looking at how we can help socialise some of the learning from the project within all the networks of young carers organisations. I don't know if that's something we could do.
That's definitely sounds like a great idea, John.
Laura,
Let's
can you hear
pick
me?
that up. Yes, I can confirm that the powers of the internet gods are with us and Petra is
Yeah, I'm really
back.
sorry.
That's okay, you don't need to apologise, it's not your fault. So if we can spotlight Petra now, please.
Yeah, I'll go
And
as
then
quickly
we
as I can.
can
Sorry about that.
that's please don't you don't need to apologise, and then Petra will go straight over to you now. Thanks everybody.
Yeah. Well, I apologize once again. For some reason, the Wi-Fi was working perfectly fine and it just cut out. So I'll skip this bit. I'll just go. I'll summarize sort of how we sort of fulfill our aims to try and make sure that everyone's living physically active lifestyles. We've got the HealthWise scheme, so this is tailored towards people who live with health conditions, and we've got the physical activity referral scheme, the adult weight management, Better Balance. So a number of programs that try and make it as easy as possible for residents to take part in physical activity through subsidized memberships. We've got the Gilla Sports Foundation, which supports local athletes in and around the UK through free memberships, financial support, physiotherapy. We also host community events, open days, taster sessions, one of which was for Carers UK, which I will go through in just a minute. We've got satellite sessions where we go out into the community to deliver physical activity for community groups with the target, with the aim of trying to bring them back into our leisure centres. And then we've also got inclusive sessions as well as memberships, such as the Give It a Go membership, disability membership, refugee membership, just to give a few examples. So one of the reasons why we wanted to support Carers Active, the Active April campaign was, as Patrick mentioned earlier on, that carers face many barriers when trying to access physical activity. In Barnet specifically, we've got around 40,000 informal carers, and a quarter of these provide care for over 20 hours each week. So the rationale was there to support carers, and it's our job to tackle these inequalities. So we put a plan together, sort of put that forward to the corporate team. Just before I go into that, we obviously follow the guidance from the UK Chief Medical Officer's physical activity guidelines. We know that there are young carers as well as older adult carers in the borough, and sort of for young people, they should be trying to do at least 60 minutes per day across the week. And then for older adults, it's at least 150 minutes of moderate intensity activity per week, or at least 75 minutes of vigorous intensity activity per week. And there's different types of activities that take place in our centres. And I guess sort of it was our aim to try and promote that to carers, to invite them into our centres, to show them what we've got on offer, so that they've got sort of the understanding that they're more than welcome to come into our centres to try swimming, to go to the gym if they like, or to play badminton in the sports hall. So this was the partnership that we had. The offer, we had a membership offer for carers, so for Carers UK members as well as carers in receipt of the carers allowance, and this offer was in place between the 17th of April and the 14th of May of this year. It was an unrestricted £30 per month membership, which included everything. They could access any leisure centre across the UK at any time. So as I said before, we wanted to eliminate as many barriers as possible, and we know that there are only certain times during the day, during the week, where carers can access leisure centres where they've got some time to themselves. So we wanted to give them as much opportunity to explore that through giving them an unrestricted £30 per month membership, which would usually cost just under £100 a month. And in order to sort of showcase that to members, we hosted an open day, invited local carers in Barnet through working with Barnet carers, Barnet young carers, local organisations to invite their carers down to Barnet Copthall Leisure Centre to meet the team, to ask any questions they have, and then to try some physical activity as well. We had swimming, walking, and short tennis, badminton that they could try out if they wanted to. Just as a little case study that I've been working on, we had Anita there pictured on the left with her auntie that she cares for in the middle. So she was on a pay and play membership before, but she wanted something that was more committed. And it was perfect timing. The Better Health UK Carers membership came along and gave her anytime access to gym, swimming, fitness classes, and anything else. And she's really sort of found this beneficial, and she's really enjoyed it. And we continue to see her using our facilities to this day. So all in all, it's been really beneficial. And Anita's not the only one. We've had a number of carers that have sort of enjoyed the use of this offer, and it meets our targets of trying to make it as easy as possible for carers to engage in physical activity and exercise. I hope that was quick enough, Laura. And again, I do apologise for the loss of connection.
I think that was an admirable rattle through, Patrick. Well done. You're a superstar. Please don't apologise about your internet stuff. That's absolutely not your problem. So a huge thank you to all of our speakers. So Patrick, James, Steve, Taskin, and Petrit. So enough of the death by slides PowerPoint now. It's over to you for a slightly shorter period of questions than we had planned. And I just wondered if anyone has any questions. We can go for the hands up function, which is the raise thing at the top right of my screen. Oh, straight off the bat, Yolanda.
Hi, yeah, it was about the Barnet Carers gym membership. Is that £30 a month? Is that restricted to, can they just cancel, or do you have to give 30 days notice?
No, I mean, it's no longer on offer. It was only on offer between April and May. So we don't have it as an offer anymore. But yeah, if someone did sign up, they could cancel sort of pretty much whenever they like. But if they did cancel, they wouldn't be able to get it back because that was in place only for that month. If they took it out during that month, then they've got it sort of forever. But it was only in place for that month.
That 1 month. Okay, fab. Thank you.
Just to add on that,
sorry.
no, that's okay. Just to add on that, Yolanda, that we're working with GLL sort of on an ongoing basis, and we hope to have that offer running at other times during the year, and hopefully maybe for a slightly longer period. But that, yeah, Carers Active April was sort of a trial for that.
Yeah, I think in Cheshire West, I managed to get our local leisure centre. We have WorkFit memberships within the council. So if they receive a letter from our commissioned carer service, if the carer gets a letter from our commissioned carer service and take it to our council leisure centre, they will get that WorkFit membership, which is £29 a month.
Right.
All year round. So
oh, great. Yeah, no, that's really good. Yeah, that sort of good practice is really good. It's something we'd look to compile, I think, is some more examples of that. So yeah, thank you, and I might follow up with you about that.
Okay.
Brilliant. Thank you, Yolanda. Any more questions for our fantastic speakers, please, who we are just spotlighting now so you can see them all, as well as all your lovely faces as well. Emma, did you want to come off mute to ask your question, or I can ask that question for you?
Yeah, sure. I just wondered if
Thank you.
anybody. Hi, Emma Krasinska from Lincolnshire, and I'm kind of interested in the experience of former carers as well as active carers. Just thinking about how absolutely difficult it can be to carve out that time to be active for yourself, and especially you know, when you are in the deep intensity of a caring role. And I just wondered if anybody was doing anything on former carers, and just that, you know, getting back to a healthier lifestyle than a caring role might have previously permitted.
Yeah. So in terms of former carers, there isn't anything specific for former carers, but essentially, if someone's been a carer in the past and now they're no longer caring, we still want them to come into our leisure centres. That's why we've got our memberships, concessionary memberships, as well as the here in Barnet, we've got the Fit and Active Barnet card, which is a free card for all Barnet residents, and it gives them not anytime, but discounts on pretty much everything that goes on in our centres. So we've got a number of initiatives that aim to try and keep these demographics in our centres, whether or not they're caring. So we don't have anything sort of specific for former carers, if that makes sense, but we do have sort of everything just for the general population, which I guess that demographic would fall under.
Thank you.
Thank you. The next question is from, Steve, or are you wanting to come in with an answer?
No, I was just going to say with former carers, we tend to continue to support carers for 12 months after the caring role ends.
Oh, wow.
And during that 12-month period, we try to encourage them to maybe volunteer for us or offer some like a peer support role to carers. So, and if they do that and they transition to becoming a peer support coach or a volunteer or whatever we might call them, it means they continue to work with us and they can continue to support carers who are still in a caring role. So it works quite well that we do find quite a few former carers will stay with us and help us to deliver the activities and services.
Brilliant. Thanks, Steve. Bryony, I'm going to pass swiftly to you for which I think might be our last question. So we're so sorry. If you have got other questions, please do place them in the chat. But Bryony, over to you.
So it's not really a question, but we do have some walk and talks for former carers. So it's aimed at former carers and also carers that have been bereaved. So it might be that we've obviously got some active carers who have suffered a bereavement as well. And then the idea is that they've got that opportunity to talk.
Oh, I'm so sorry. I've lost audio on you, Bryony. But that walk and talk service that you're mentioning sounds really good. I'm really sorry, but we have run out of time, which feels such a shame. So if you have got questions that we didn't get to answer, I would love it if you could paste those in the chat and we will see if we can get those answered for you. We're just going to put up our final poll now, which is to say how confident do you feel now in engaging with the Carers Active campaign. And we're also pasting a link in the chat about our active medicine workshop, which is going to be a fantastic case study about what they're doing, which is on the 15th of November from 11 AM to 12 noon. So please do save the date for that. It's a free workshop all about how and why physical activity is so important. So whether you're an organisation or a professional supporting carers, do join this workshop, which we've organised through the Carers Active campaign, just to hear more about the benefits of physical activity and the health and wellbeing benefits of moving more, especially for older people, but for everybody as well. The link is in the chat, or it will be very shortly, and we will also include it in the follow-up email after the webinar. Now, I just need to see what we can find for the poll. It looks like we've upped the number of people who were quite confident, which is fantastic. And we've reduced the number of people who were quite unconfident, and we've increased the amount of people who were very confident as well. So, and we've lowered the amount of people who were not sure. So, I mean, I think that's got to be good. So we just wanted to say thank you very much to everybody for coming today. Please do register for the Active Medicine webinar. Thank you to all our fantastic speakers for giving up your time and sharing your expertise. And thank you to you for coming. Thank you very much, everybody.